Hello, I'm Dr. Eleni Habidou. I'm a psychologist with the Michael J. DeGroot Pain Clinic. I work with people with chronic pain. I've been using yoga now for over 10 years in order to help my patients. Yoga is a very ancient technique. It originated in India over 5,000 years ago. It began to come to the West in the 50s and 60s and has since become part of fitness programs and complementary therapies around the world. In the hospital environment, we can use yoga to promote recovery, to promote rehabilitation, and to help patients become more limber and even more fit by learning to move their joints and their muscles better. So the yoga that I have designed for you so far involves very gentle exercises. These exercises are designed to promote movement, to help you breathe through them, and to help you free your joints and muscles from stiffness. All exercises in yoga, or asanas as they are called, they are performed with awareness of your breath. For example, you breathe in for half of the exercise and you breathe out for the other half. So the breath and the movement are always coordinated. Yoga includes relaxation, breathing, and asanas. Breathing is called pranayama in Sanskrit, and relaxation is called shavasana. We've done relaxation here before many times, and you know how to go about it. There are also various CDs that are provided for this purpose. Here in this video, we will not go through relaxation. However, just to let you know that all yoga practice begins with relaxation or shavasana and ends with relaxation or shavasana. And in between is the breathing exercises in coordination with all the asanas. Base position, Parambik Sthiti. Be careful if you have a wrist or back injury. It can be done while sitting in a chair as well. Sit with legs stretched in front of the body. Hands are on the floor, slightly behind buttock, with a slight backward incline of the body. Back, neck, and head are straight. Straighten your elbows. Your legs are slightly apart. Close your eyes and relax the whole body in this position. Toe bending, Padanguli Naman. Sit in the base position. Keep your feet upright, your ankles relaxed and still. The awareness is on your toes. Slowly bend the toes of both feet forward, then slowly bend them backward. Repeat with a slow rhythm 5 to 10 times. Inhale as the toes move backward. Exhale as the toes move forward. Be aware of your breath, counting mentally, and of the stretching sensation produced by the movement. Hold each position for a few seconds. Cautionary point: if you have an injury or a problem in one of your feet, the advice is that you begin with the foot without the injury, so that your brain gets the right message that it is possible to perform this exercise. Then, after you get the hang of it with your better foot, then you can also use your injured foot, but do fewer exercises and without moving into the pain sensation. Ankle bends. Gulf Naman. Sit in the base position. The awareness is on your ankles. Slowly move both feet back and forth, bending at the ankle joints. Try to stretch the feet forward to touch the floor and draw back towards the knees. Hold each position for a few seconds. Repeat with a slow rhythm 5 to 10 times. Inhale as the feet move forward. Exhale as the feet move backward. Be aware of your breath, counting mentally, and of the stretch in the foot, ankle, calf, and leg muscles or joints. Ankle rotation. Gulf chakra. Sit in the base position. Legs and body are relaxed. Movement only in the ankles. Awareness is on your ankles. Breath, mental counting, and rotation. Slowly rotate the right foot 5 to 10 times clockwise, as wide as possible. Imagine that you are drawing a big circle with a piece of chalk at the end of your big toe. Rotate the other way 5 to 10 times. Repeat with the other foot. Again, cautionary point: if one of your feet was injured or has any other problems at this point, you want to begin with the non-injured foot first, get the hang of it, before you repeat the exercises with the problematic foot. And in this case, you do fewer exercises with your foot that has the problem. Awareness is on your ankles. Breath, mental counting, and rotation. Ankle crank. Gulf Gurman. Sit in the base position. Bend your left knee and place your left ankle on the right thigh. Your left hand is resting on the left knee. Your right hand is holding the toes of your left foot. Rotate the left foot with your right hand one way, then rotate the other way 5 to 10 times. Return to the base position. Repeat with the other foot 5 to 10 times. Awareness is on your ankles, breath, mental counting, and cranking. Inhale on the upward movement. Exhale on the lower movement. Kneecap contraction, Januphalag Akarshan. Sit in the base position. Your awareness is on the kneecap, breath, and mental counting. Contract the muscles around the right knee and draw the kneecap back towards the thigh. Hold it for 3 to 5 seconds. Release, relax, and return the kneecap to its normal position. Practice this 5 times. Repeat with the left kneecap 5 times. Then do both knees together 5 times. Knee bends, Janu Naman. Sit in the base position. Your awareness is at the hip and knee, breath, mental counting, stretch in the thigh muscles, and doing this pose in one movement. Bend the right knee as much as possible and rest the thigh on the clasped hands, bringing the thigh up close to the chest and the right heel close to the bum. Straighten the leg, but do not allow the leg or foot to touch the ground. Repeat 10 times. Inhale while straightening the leg. Return to the base position and repeat with the other leg. Exhale while bending the leg. Inhale while straightening the leg. Exhale while bending the leg. The benefits of this exercise is that it stretches the hamstrings and back muscles. Arms and chest muscles are also involved. Double knee bending, Dui Janu Naman. This is the same as above, but with both knees. Knee crank, Janu Chakra. Sit in the base position. Bend the right knee. Rest the thigh on the clasped hands and hold the thigh near the trunk of your body. Place your awareness in the knee and rotate the lower leg in a circle above the knee 5 to 10 times. Rotate the other way 10 times. Return to the base position and do the other leg. Benefits: quads or thigh muscles, ligaments around the knee joint, arm muscles, elbow joint, and shoulders. Half butterfly, Ardha Titali Asana. Caution: if you suffer from any hip or spine issues, talk with your doctor before you can engage with this exercise. Sit in the base position. Bend the right leg and place the right foot as far up on the left thigh as much as possible. Place the right hand on top of the bent right knee. Hold the toes of the right foot with your left hand. This is the starting position. There are 2 stages to this exercise. Stage 1, breathing in sync with the movement. While breathing in, gently move the right knee up towards the chest. Breathing out, gently push the knee down and try to touch the knee to the floor. The trunk should not move. Benefits. Good practice to loosen up the knee and hip joint. Do not force this movement in any way. The leg muscles should be passive, the movement being achieved by the exertion of the arm. Slowly practice 5 to 10 times up and down movements. Awareness is on your breath, mental counting, movement of the hip joint, and relaxation of the inner thigh muscles. Stage 2, without breathing in sync with movement. Remain in the same position with the right leg on the left thigh. Relax the right leg muscles as much as possible. Push the right knee down with the right hand and try to touch the knee to the floor. Do not strain. Let the knee spring up wide. The movement is achieved by use of the right arm only. Practice 30 up and down movements in quick succession. Awareness is on your breathing, which is normal and not related to the practice. However, if you want, you can skip stage 2 practice here. Hip rotation, Shroni Chakra. Benefits. Hip opener, aids in digestion and other body systems. Sit in the base position with the right leg on the left thigh. Awareness is on breathing, mental counting, and rotation of the hip. Using the muscles of the right arm, rotate the right knee in a circle. The circle should be as large as possible. Point the index finger out to use it as a guide with making the circle. Do 5 to 10 one way and then 5 to 10 the other way. Straighten the leg slowly and release the knee. Repeat with the left leg. Inhale on the upper movement. Exhale on the downward movement. Full butterfly, Purna Titali Asana. Benefits. SI joint, outer thigh muscles, shoulder, arm, and hand muscles. Sit in the base position. Awareness is on mental counting, movement, and relaxation. Normal breathing is unrelated to practice. Bend the knees and bring the soles of your feet together, keeping the heels as close to the body as possible. Fully relax the inner thigh muscles. Stage 1. Clasp the feet with both hands. Gently bounce the knees up and down, using the elbows as levers to press the legs down. Try to touch the knees to the ground on the downward stroke. Do not use force. Practice 30 to 50 up and down movements, or as many as you can. Stage 2. Keep the soles of the feet together. Place the hands on the knees. Using the palms, gently push the knees down towards the floor, allowing them to sprint up again. Practice 20 to 30 times, or as many times as you can. Do not force this movement. Straighten your legs and relax. Hand clenching, Mushtika Bandhana. Benefits: helps develop a firm grip, strengthen the joints in the hands. Sit in the base position or cross-legged pose. Awareness is on the breath, mental counting, stretching sensation, and movement. Hold open your arms straight in front of the body at shoulder level. Open the hands, palms down, and stretch the fingers as wide apart as possible. Close the fingers to make a tight fist with the thumbs inside. Inhale on opening the hands. Exhale on closing the hands. Repeat 5 to 10 times. Wrist bends, Manibandha Naman. Benefits: the joints in the wrist. Sit in the base position. Stretch the arms in front of the body, shoulder level. Keep the elbows straight. Keep the palms open and fingers straight throughout this practice. Do not bend the knuckle joints. Awareness is on the breath, mental counting, movement in the wrist joint, and stretching forearm muscles. Inhale with the backward movement. Exhale with the forward movement. Stretch the arms in front with palms facing away and fingertips pointing to the ceiling. Awareness is on the wrists while the fingertips are slowly brought down to point on the floor. Then slowly return them to point towards the ceiling. Slowly repeat and with complete awareness of the wrists 5 to 10 times. Make sure there is no tension in the arms and hands. No energy is going out. Only the wrists are being bent. Bend the hands backward from the wrists as if pressing the palms against a wall with the fingers pointing toward the ceiling. Bend the hands up again for the next round. Repeat 5 to 10 times. Wrist rotations, Manibandha Chakra. Benefits: the joints in the wrist and hands. Sit in the base position with the sole flat on the floor, knee up, rest of the forearm on the knee. Keep the back straight. Awareness is at the wrist and hand. Stage 1. Extend the right arm forward at shoulder level. Fist with the right hand with the thumb inside. The left hand may be used as support if needed. This is the starting position. Slowly rotate the fist around the wrist. Make sure that only the wrist is moving and not the arm turning. Repeat with the left fist. Make a circle as large as possible. Practice 10 times one way, then 10 times the other way. Stage 2. Extend both arms in front of the body with the fists clenched. Keep the arms straight and at shoulder level. Rotate the fists together in the same direction. Practice 10 times. Stage 3. Rotate the fists together in the opposite direction. Practice as in stage 2. Practice 10 times with each direction. Elbow bending, Kehuni Naman. Benefits: the muscles, joints in the arms and elbows. Sit in the base position or cross-legged pose. Raise arms and stretch them out in front with the palms upward. Slowly bend the elbows and the palms of the hands to touch the shoulders. Keep the elbows at chest level. Then slowly straighten the arms again. Repeat 5 to 10 times. Bring the hands back down to the knees to rest the arms. After the rest, raise your arms again. Keep awareness at the elbows, this time to the sides, palms up. Slowly bend the elbows and bring palms to touch the shoulders. Then slowly straighten your arms to your sides. Repeat 5 to 10 times. Inhale while straightening the arms. Exhale while bending the arms. No tension in the arms or hands, on the breath, mental counting and movement. Keep your back, neck, and shoulder relaxed throughout the practice. Shoulder socket rotation, Skanda chakra. Benefits: the muscles and joints of the shoulders, chest, and cervical spine. Sit in the base position. Make sure your head, trunk, and spine are straight and still. Awareness is on the breath, mental counting, and the stretching sensation around the shoulder joints. Stage 1. With the fingertips or palms resting on the shoulders, slowly rotate the shoulder sockets by drawing big circles with the elbows. First with the right arm, then left. Repeat each exercise 5 to 10 times one way, then 5 to 10 times the other way. Inhale on the upward stroke. Exhale on the downward stroke. Stage 2. Place the fingers of the left hand on the left shoulder and the fingers of the right hand on the right shoulder. Fully rotate both elbows at the same time in a large circle. Try to touch the elbows in front of the chest on the forward movement and touch the ears while moving up. Stretch the arms back in the backward movement and touch the sides of the trunk while coming down. Practice 10 times one way, then 10 times the other way. Inhale on the upward stroke. Exhale on the downward stroke. Head and neck movement, Griva Sanchalana. Benefits: the muscles of the neck and shoulders. Sit in the base position for all stages. Bring awareness to the neck. Stage 1. Slowly exhale and tilt the head forward, bringing the chin close to the chest. Inhale and slowly raise the chin up as high as possible so that the head is touching the shoulders at the back. Do not strain. Repeat slowly and evenly 5 to 10 times. Stage 2. Facing forward, place the palms on the knees and straighten the elbows. This will raise the shoulders. Tilt the head to the side so that the right ear touches the right shoulder. Then touch the left shoulder with the left ear. Sync your breath with your movement. Repeat 5 to 10 times to each side. Awareness is on the breath, mental counting, and movement. Stage 3. Starting from the same position, exhale and turn the head to face forward to the right so that the chin is over the right shoulder. Inhale as the head is slowly turned back to the center and on around to the left so that the chin is over the left shoulder. This is one round. Inhale to the left shoulder. Exhale to the right shoulder. Repeat 5 to 10 rounds. Awareness is on the breath, mental counting, and movement. Stage 4. Facing forward with palms on knees and elbows straight. The shoulders are raised. Chin is brought forward to rest on the chest. Slowly circle the head around so the left ear comes in contact with the left raised shoulder. Continue on around, chin raised, high rolling the head across the shoulders, bringing the right ear to the right shoulder. Continue the roll until the chin is resting against the chest. This is one complete circle of the head. Do this slowly and with awareness. Be as relaxed as possible. Repeat 5 to 10 rotations one way, then 5 to 10 rotations the other way. If you get dizzy, open your eyes. After the practice, keep the neck straight and your eyes closed. Be aware of sensations in the head and neck. Inhale as the head moves up. Exhale as the head moves down. Awareness is on the breath, mental counting, and movement.